This is the upper second left molar. That first point of contact where the red spot is where the jaw joint, when it comes in a nice even way, it's the only spot that touches. You can see a little bit on that first premolar, but that's actually the thickness of the articulating paper. We're using a AccuFilm and double-sided, and you can see the space right there between the teeth. When he bites down, you'll see the jaw posture forward and a little bit to the side. And right about now, you'll see him close, and you'll see how much his jaw moves when he does that. See, in that direction. It's about a 2 millimeter vertical slide and a little bit to the patient's left. Now we're going to verify the movement on the left, and so we dry off the teeth, get a more of a anterior view here. And we're going to close the jaw, and as you can see, the jaw is moving really relatively well. Most people have more of a difficulty in closing their jaw. This particular patient doesn't. We're putting a little bit of air on the lower anterior teeth to remove the saliva, and we're lining up the space between the two central incisors. That's tooth number 24 and 25, and you can see the diastema between the upper two, and we're just trying to get a really good feel for that. We can see the space between the canines on that upper left area. And we're going to have the patient bite down, and you'll see his jaw move just a little bit off to the patient's left. There's the air. We've got everything lined up. We're looking really good. We're going to ask the patient to close down, and you can see the jaw joint move, maybe 3/4 of a millimeter, maybe a millimeter to that left. And that's always a difficult situation. Truly don't like to have that. We have the patient bite down on regular articulating paper, and you can see the really hard spots. Tooth number 14 actually didn't have any really much of a spot there. It turns out that that's just the articulating paper, while the other hard marks are where the patient is touching down. This is troll paper. It shows up a little bit better when you're using it. And there's that spot, first point of contact, almost nothing on the first molar. And then on the other side, he is touching the second molar, and then he has 3 new crowns there. The first molar has some contact, a little bit of contact on the second premolar, but none on the first premolar. As we go ahead and look at his anterior teeth, tooth number 6 and 7 have contact, but truly it doesn't look like there's any contact between 8, 9, and 10 and 11. And so we have the patient bite down hard again. And you say, well, maybe there's a little spot there. And as it turns out, that's the articulating paper again. And we use some artist paper, which is thinner than articulating paper. And you can see how it touches a little bit there on 6, but not on the other anterior teeth.